changing the way we think and how we live our lives is one step in the right direction. Welcome to Be Well Berkshires. I am your host, Jim Willis. I am the administrator of the Be Well Berkshires Community Initiative. Be Well Berkshires is a mass in motion initiative that is designed to promote policies and programs to foster healthier lifestyles. Well, what does that mean? Well, it means that we want you to eat better, move more, and be well. The format of this show is to speak with community members on what's going on in our community regarding health and wellness activities and to bring that information to you. I want to welcome Dr. Mark Pettus, who is our guest today on the Be Well Berkshire Show. Dr. Pettus, well, welcome to the Be Well Berkshire Show.
Hi, Jim. Thank you for having me. Glad to be here.
So tell us a little bit about yourself.
So I've been in the Berkshires for over 25 years, and I've been really connected to Berkshire Health Systems for most of my professional life. My background clinically is in internal medicine and nephrology, which is a specialty of the kidneys and high blood pressure. So for many years, I cared for people who were pretty sick, who had a lot of health issues, diabetes, high blood pressure, heart disease, depression, and began to reach a point in my life, I'd say maybe 10 or so years ago, where my interest began to shift in how I could help others prevent these health issues from occurring. So I have much more of a prevention and wellness lens that I look at a lot of my work, and so it's been an exciting transition for me.
Yeah. So you're the director of medical education, wellness, and population health.
Yeah.
That's a lot of words to, as a title, and you probably have other credentials and titles as well. So what does all that mean?
Yeah, so as Director of Medical Education, Jim, I oversee our residency training. So people in the Berkshires may or may not be aware that Berkshire Medical Center has trained residents. So these are young physicians who've completed medical school from all over the country, all over the world. They come to the Berkshires to get more training, and we have programs in internal medicine, general surgery, psychiatry, and dentistry. So part of my role as director is to make sure that we're creating the best learning environment for those trainees and preparing them to ultimately go on and serve others in the communities that they ultimately settle in. I also help with our medical student rotations. We have affiliations with the University of Massachusetts Medical School. It's a long-standing affiliation, and the University of New England College of Osteopathic Medicine. So we have students in their third and fourth years that come out and experience various clinical areas from medicine, surgery, psychiatry, pathology, and ultimately that experience helps them determine which field they may want to go into and ultimately do their residency training in. So it's an exciting time to be engaging in young physicians and hopefully shaping their lives in a very meaningful way.
That's wonderful. Yeah.
On the wellness and population health side, the health system has long had a connection with many of the employers in Berkshire County. So we look at wellness from the perspective of helping employers engage their employees and all that we can do, whether it's through education, screening, assisting some of the initiatives that they may have in their organizations to improve the health of their employees. And we know that that's an important contributor to productivity and obviously very important as many companies now confront healthcare costs to insure those that they employ. So these are very good partnerships to help reduce some of the costs and many of the challenges that occur now in the workplace. Wellness also involves what we do in the community, which you're very well aware of in the work that you do. Excuse me. And a lot of that is screening, a lot of it is education and outreach. And the population health piece is kind of a new buzz in healthcare. It's really part of the Healthcare Reform Act. And the Obama legislation has challenged us all to be more effective stewards of precious resources. So how can we actually improve the health of those that we serve in our communities, and do so with more efficiency in our resources. And a lot of that really is about prevention and wellness. So these are really great positions for where I'm at in my career, and certainly very important for our county right now.
Yeah, absolutely. The health systems has done, at least from my perspective, has done tremendous amount of work in the community. You know, from a community-based organization like Tri-Town Health Department, Well Berkshires, the health systems they're everywhere. Whether it's you're talking about community health and wellness with a van, to the CEO David Phelps, practicing what he preaches. He had his own personal story, and it really has reinvested into wellness of their employees and even their spouses. But like supporting community members, I mean, we had this huge gap in North County, with North M's regional closing, and once again the health systems has stepped up, and I think health systems is a tremendous partner to us community members, and I think we've come a long way. And I'm not sure if other communities benefit from their local hospital and the work that they do, whether it's community benefits or other investment into the community. But we're very fortunate in Berkshire County to have such a great organization, whether it's Fairview and Berkshire Medical Center, and we still need to figure out what's going on up in North County. Yeah. But I think we're really lucky to have good synergy on all levels.
Yeah, absolutely, Jim. The health system under Dave Phelps' leadership for the last 20 years has evolved in a remarkable way. As you and many of the watchers know, it's a challenging environment. Many small community hospitals around the state and around the country have been forced to close their doors because of many of the economic challenges that exist now in healthcare. And many hospitals and health systems, traditionally tend to focus on what happens in their hospitals. Berkshire Health Systems has long been out in front of what's happening in the community, and it was one of the things that attracted me to come here from Boston over 25 years ago. It was the extent to which I felt as a professional I could be touching those that I serve in a more powerful way. And I think the role of the health system has continued to evolve and become even more important, particularly with the closure of North Adams Regional Hospital. And there's a lot going on right now in an attempt to create an infrastructure in northern Berkshire County that can help meet some of the critical needs that have been left by the closure of North Adams.
Yeah, we talked about this before on our show about the demographics. There's reports that have been coming out. Berkshire Regional Planning Commission released a study, a few months ago, how our community is going to look like by 2020, and we are an aging population. It seems part of what you do is population health. And what's your sense on what this county is going to look like, 10, 20 years from now? I mean, we're trying to work on economic development, keep our young people, send them off to school, come back. There needs to be jobs. But, we see in a senior population, we see it at the health department level where the housing stock's older and people are on fixed incomes. People are afraid to go to their primary care. And, that's one of our concerns about an aging population. The dynamics could be significantly different 10, 20, perhaps even 30 years from now.
Absolutely, Jim. So, the Berkshires, while those of us who live here are quick to point out of all the beautiful aspects of being here, we have these beautiful natural resources. We all know that it's a wonderful place to raise our children. And at the same time, we have so many economic challenges right now. And when you look at many of the contributors to public health and population health, many of them are not well suited for what we may confront over the next 10, 20 years. We do have an aging demographic here. And many people, as they get older, do have more health issues. That's certainly true here in the Berkshires. Economically, we know that when you're confronting economic challenges and for people who are just struggling to get through the day and to make ends meet, it becomes almost impossible to focus time and attention on how you're caring for yourself. And we know that for many people that we serve here in the Berkshires, that is an enormous challenge. We're geographically spread out, so we serve about 130,000 people in Berkshire County, but many people don't have access to public transportation. Many people live alone and are a bit more socially isolated. So we know that these are all major contributors to health and wellness. We know that many of these factors are far beyond what any hospital or health system can easily remedy or reconcile. So it really forces us as a county to be coming together and engaging in ways that can create more innovative partnerships, some of which you and I are involved with through some grant work. So I think we have our work cut out for us over the next 10 to 20 years. And at the same time, I think we have more resources, natural resources, clinical resources, educational resources than ever to be leveraging those partnerships. And I truly believe that the Berkshires could be the healthiest county in Massachusetts. There's absolutely no doubt in my mind. But we have a lot of work to get there, and I know there are a lot of really good things happening to begin to look ahead and how we can be successful in that endeavor.
And absolutely, you touched base on some of the work that we're working on together, which is a good segue into talking about the Prevention Wellness Trust Fund grant that Berkshire Health Systems is actually taking the lead on, but it's really bringing community organizations partnering with the clinical organizations countywide. And so with that process, there was actually legislation that was passed that they actually secure funding over the next 4 years to really create this bi-directional referral system that links community to clinical, from community back to clinical, and it's an infrastructure that we need to create, and that's how you and I met. We're meeting all the time. We're looking at multiple interventions: tobacco, falls, diabetes, hypertension.
Yes.
We definitely have our work cut out for us, but for those watching the show, let's say this: we're working really hard. We're communicating. I think we're starting to get people on the same page,
yes.
And we're going to be rolling out a lot of prevention services and programs definitely in the next coming months, which is going to go from corner to corner countywide, which is a big endeavor. But I think we're not going to make any changes unless we do it together.
So we confront this enormous opportunity now, Jim, and I think the fact that you and I are even sitting here today says a lot about this landscape and how it's bringing people together who care deeply about these communities, who are raising kids, have families here, who work here, and who recognize that stakeholders in health include our schools, include the workplace, include our boards of health, include the Y, include the Northern Berkshire Community Outreach Program that Alba Shevkin. There are so many people who are committing their lives to helping the neighbors that they live and serve. Yet, I think what we all recognize now is we need to be coming together in a way that can allow us to better leverage the work that we're doing. And I think my sense, and I know you would agree with me, Jim, is that there are many grants on a state level that we are not only receiving currently, but are going to continue to be very competitive around, because the Berkshires, I think, are unique. We can do things here that you can't do in Boston or Worcester or Springfield, and so much of we are developing, I think, state and even nationwide could eventually become models that other communities can reproduce. And what I love about it, and I know this is what motivates you and all that you do, is it really is about empowering individuals to be able to care for themselves in a more effective way. So it's all about lifestyle. It's all about healthy eating and healthy movement, connecting with other human beings in more positive and joyful ways, looking at ways to reduce stress and getting off habits like smoking. But people need help with that. It's not enough to say, pull up your bootstraps, you know what you need to do. It's all about willpower. That just does not work. So I think the grant, as we are developing it, can so beautifully begin to connect people to resources and systems that can truly help educate them and support them and move them forward. And that, I think, is the secret sauce to what we are doing, and it gives me hope.
Yeah, as well, I agree. You know, a perfect example of this bi-directional connection is, you know, if patient A goes into their physician and they're pre-hypertensive or they're at risk for falls, we'll automatically have an infrastructure now to refer to community programs, and then enroll those folks into community programs and track them, and then refer that back to the primary care, which is something that really doesn't happen too often now.
Yes.
And hopefully we'll have resources to help those stay on point. Like you said before, it's easy to say, well, quit smoking, or, you know, lose 30 pounds because your HDL and LDL cholesterol are through the roof. You know, but lifestyles they make it hard for us, and the environment, you know, and I think it takes multiple facets to really change population health. You need to have the resources, you need to guide folks to where they can access those resources. Obviously, primary care is an important thing, and good communication, knowing what type of cessation services are being offered countywide. Now, I think we sort of understand what's going on, but it's really up to the patient to navigate themselves to find where these community programs will be. So I think we'll try to help navigate that. And part of Well Berkshires and Berkshire Health Systems and Northern Berkshire Community Coalition and the Public Health Alliance, and I'm really excited, even though we're probably creating some stress ourselves.
Yeah, so it's a daunting task. But as you pointed out up front, Jim, and I hope the viewers can appreciate this, there's a lot happening behind the scenes to advocate for the people we serve in Berkshire County, and it is a different level of engagement because it really is about education, and it is about the environment, and it is about partnerships and communication that can help effectively guide people. You know, we've got a critical shortage of primary care in our communities, and you know, my primary care colleagues are just unbelievable people who are so busy, who are so overwhelmed, and just trying to get through the day. They need more support. So this grant, in addition to helping individuals connect to the resources that can help them be stronger, have more balance, be more likely to quit smoking, manage their diabetes or high blood pressure, we're also trying to create systems that can support our primary care providers so that our providers can take an individual they're serving and hand them to a system that can automatically begin to connect them to the services, which is something that most primary care practices are simply unable to do and don't have the infrastructure to do. So they need help as well, and I think that's a lot of what we're trying to do.
And I think we've learned so much, you know, bringing the community partnerships and bringing the clinical folks together. I think we've learned a lot being in the same room. And you know, when I go to my physical once a year, my doctor's straight out, you know, and he's in, he's out, he's in, he's out, and you know, somewhere along the line, if you have high blood pressure, you need to lose a few pounds, we need some type of intervention there and now. And so I think this grant will provide some of those resources to help the community folks, it'll help the clinical folks, and really get people on the same page.
Yeah.
And I think that's really important. And part of Well Berkshires, it's a community initiative. Well, the community, just like population health, encompasses everything within the system. So it's really important stuff. And you're absolutely right. I think, you know, there's a lot of work going on behind the scenes that it's not published, it's not in the routine papers, it's not in the media, but rest assured we're working really hard to really make a change in the county. And what a perfect look coming off exit 2, or you know, off the Pike, or even if you're taking Route 2, Mohawk Trail, which is highlighted in the Eagle today. You know, the healthiest, you know, county in not only the Commonwealth, maybe the country. So, but prevention, I think, is the $1 million, you know, statement. Is, we know there's a return on investment with prevention. It's so hard to really get to that point because it's not real dollars right now. It takes time to have that return on investment prevention, but we know that we spend a lot of money in healthcare costs, and part of what we work on in the tobacco world. I mean, in 2010, $4.3 billion was spent in healthcare costs attributed just to smoking.
Yeah, it's amazing.
You could balance a budget with that kind of money, and I don't even know what the numbers look like for obesity and hypertension and falls and all those other risk factors, and there's a lot of work to do.
Yeah, the numbers are staggering, Jim. We know that about 75% of every dollar spent in healthcare for a chronic complex disease, obesity, high blood pressure, diabetes, Alzheimer's, cancer, autoimmunity, heart disease, can be attributed to lifestyle and behaviors. So, we spent $2.6 trillion in healthcare in 2013 in the United States. 75% of that enormous amount of money was to treat health issues that ultimately could have been prevented. So I think everyone is beginning to break under the burden and the economic reality that we confront. So I think one thing that is refreshing in all that we're talking about is that prevention and wellness is finally starting to become hot, a bit of a buzzword, and that's, I think, the exciting aspect of where we're at right now.
Yeah, I think overall health and wellness has really. I was talking this morning at Berkshire Community College with some of the intern students there. From traditionally the health department, it was really about inspectional services. Yes, we do the flu clinics and try to keep the communicable diseases at bay, but we've really seen a dynamic shift in health and wellness over the last 10, 15, 20 years, and we're probably going to see it even more. I mean, the schools are talking about it, governments are talking about it, clinical partners are talking about it. I think it's really important to, to raise the kids now, the new generation, better habits on healthy eating, active living, to really prevent those long-term chronic issues in the future, which could really affect kids socially. We've seen studies where kids that are at risk of being overweight and obese, there are social factors involved there. There's acute and long-term chronic issues involved there, and really healthcare costs. And there's a lot of work to do. And I know we only have a few more minutes left, and part of what we do is really promoting healthy eating. Give us your spiel on what your thoughts are on
my elevator
healthy
spiel on healthy eating. So my spiel changes, and the science changes, but I think it's clear, Jim, that most of us consume way too much sugar, way too much refined flour. These are usually wheat-based flour. So all the things that we love, the desserts, the pastries, the soft drinks, the pretzels, the bagels, many cereal grains, many breads, pasta. These are carbohydrate-dense foods that research is more and more convincing, fueling obesity, fueling diabetes, and fueling most of these chronic complex diseases. So if people did nothing more other than to start to cut back on sugar consumption, sort of flour consumption, and to introduce more healthy fruits and vegetables, to introduce even healthier fats, things like fish, like nuts, like avocados. We know that we can eat satisfying, wonderful, fresh, and even affordable foods that could significantly turn our health prospects in a very positive direction. Food is medicine, and I think we have a lot of work to do to help people better navigate that aspect of their lives. It's a big deal.
Yeah, I know from the health department's perspective, the number of allergens that we're seeing and the number of health issues, there's something going on with our food supply, whether it's access or say inaccess to healthier foods, and all these food products that are just processed out there. And I think as we evolve as humans in this cycle, we try to navigate towards the foods that are just easy to access, and something that we try really hard working on is at least offering healthier choices. We can't force change, and we can't force people to eat healthier, but education, forums such as this to get the word out, the importance of healthy eating, and even physical activity. And I think a lot of we're always talking about you got to eat better, you got to eat better, you got to cut back your portions. But I think exercise is an important thing too. We need to figure out a way to, increase access to opportunities for people to be physically fit. It's busy, it's hard even for me to get my 3-mile run in, but we try really hard to do it. And, and there's a lot of people out there raising multiple kids and working families. It's really hard. And I think a lot of this stuff needs to sort of go hand in hand.
Yeah, absolutely. Ours is a challenging environment to make healthy choices, and I think anytime we can find something simple, cutting back on one sugar-sweetened soft drink, eating one less pastry or dessert per day, even in the workplace, just standing a little bit more if you're sitting all day every hour for a few minutes, and walking up the stairs instead of taking the elevators. Anything one can do to reproduce the kinds of behaviors that our grandparents and great-grandparents did all the time is likely to bring us to a much healthier and more positive place.
Yeah, and I think the one message as we start to wrap up the show today, I mean, it's amazing how fast the shows go by, but you can take small incremental steps in changing your lifestyle. You may not see the results today or tomorrow, maybe next month, but I think some people, they tend to get overwhelmed where it's like, oh, I need to go on an exercise program, and I need to eat better, and I don't know how to eat better. But making those small incremental changes, taking out soda here and there, eating a salad every other day, it makes a good difference. So, Dr. Pettus, thanks for joining the show.
My pleasure,
how can
Jim.
people get a hold of you?
Yeah, so they could reach me through Berkshire Health Systems, through their website if you have internet. I'm not too hard to track down. My email, if anyone is interested, is mpettus, Pettus, @bhs1.org.
Great, thanks for having us. I know you're
Jim.
really super busy,
my
but
pleasure.
thanks for taking the time out of the
My
show.
pleasure, Jim. Thank you.
I'm your host, Jim Willis. Thank you and be well.